NeedyMeds users and friends, welcome and thank you for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And today I'm going to teach you how to find healthcare savings resources on the NeedyMeds website. Before I get started, I wanted to go over a few tips so you can make the most out of today's presentation. First of all, you can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If I don't get a chance to answer your question, I will follow up with you via email. I will provide my contact information and the contact information for NeedyMeds at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. You can find a copy of the PowerPoint slide deck in the handout section of your control panel. So with that, let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagal. Rich is still our president. On the screen is our formal wording of our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we help people to save on healthcare expenses is with our listing of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs to those that qualify. Of course, not every drug will have a prescription assistance program. When one is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing a prescription, signing the application, and sometimes submitting the documentation. So, how do you find prescription assistance programs and other healthcare cost savings resources on needymeds.org? Bear with me while I transition out of the PowerPoint to our live site so I can demonstrate. As you can see, there's a ton of information on the NeedyMeds website. Since we're going to spend today's webinar checking out cost savings resources under that patient savings tab, I encourage you to explore our site further when time allows. I also want to point out a few other resources you might want to look into. First of all, on the top right-hand side with the rest of the social media icons, the third one from the left, is a link to our YouTube channel. We recommend subscribing so you can stay up to date on the latest videos, presentations, and webinars. I want to make sure that you're all aware that NeedyMeds hosts a site called Be MedWise, and you can find a link to that on the left-hand side. This site is full of accurate, up-to-date patient information and education about the safe use, storage, and disposal of medicines. As I said, we're going to spend most of today's presentation under this patient savings tab. So I recommend, when time allows, returning to the site to check out the Advocates tab. This is where you can sign up for a monthly newsletter or email alerts, order print materials, and check out other upcoming webinars. You can also see what other webinars are coming up by checking out the calendar of events on the bottom right hand of the homepage. Okay, so returning to prescription assistance programs. You can always begin your search for savings programs for medications by typing the name of the drug into the drug search bar where my cursor is blinking on the top left-hand side. If you are specifically looking for prescription assistance programs, click on that Patient Savings tab, and as you can see, a bunch of different categories pop up. And those are all different ways to save on medications and healthcare costs. The Prescription Assistance Program section is the very first box on the top left-hand side. As you can see, you can search a number of ways. You can search by the least common company or program name, and you can also search by the brand name of the drug. Let's say you're looking for help affording a name brand drug called Eliquis. You go ahead and click on that brand name drug's hyperlink. And you'll notice that the first thing you're going to see are a bunch of icons. What these icons do is they show you what type of information or savings program is available for that drug. For example, is there a savings program such as a prescription assistance program or a coupon available? Is there more information available about that medication through support pages or drug videos? You'll also notice a convenient A to Z index to make your search simple. Let's return to our search for Eliquis. I'm going to go ahead and choose the letter E for Eliquis, click on that, and then scroll down to see if it's listed in the long list of alphabetized meds. When you see the medication, click on it. And there are those icons again. The icons indicate that there is some more information about Eliquis. For example, there's drug videos and support pages. And there's also cost savings program. This icon indicates that there is a coupon available. And the icon on the far left, the very first one, indicates that there is at least one prescription assistance program available. I'm going to go ahead and click on that hyperlink. And that will take you to the Prescription Assistance Program page. In this case, there is only one prescription assistance program available for Eliquis. I know that because in the top blue bar, there's no other text indicated. If there was more than one prescription assistance program, it would be indicated in here. It would say, for example, program 1 of 3. If there is more than one program, the ones that offer the most assistance will be listed at the top, and the ones that offer the lesser assistance will be at the bottom, and then alphabetically. So let's talk about what's on your screen right now. I'm going to make the screen a little bit smaller. Don't worry about reading the text right now. I just want you to get a glance of what the Prescription Assistance Program page looks like. And there it is. So let me make that screen a little bit bigger so we can talk about exactly the information that's on your screen. Importantly, right at the top, you'll see the name of the supporting organization and their contact information. And that's really important because if you have any questions about the program, you're going to want to direct them to the program as opposed to NeedyMeds. Next is the application section. This is where you can usually find a link to the application itself. If that's not available, there'll be more information indicated. The medication section is where you will find all of the medications and formulations covered by this program. And each program also lists, really importantly, an eligibility section. Now, as I said, although eligibility requirements will vary from program to program, they are almost always based on 3 factors: insurance coverage, income, and residency. One thing I want to point out when we're talking about insurance coverage, oftentimes for prescription assistance programs, to be eligible, the patient must not have prescription coverage. But what I want to point out is that's not always the case. So don't make the wrong assumption that if you or somebody you're trying to assist has coverage, that they won't automatically be eligible. That is not always the case. So let's talk about income. Income, as far as eligibility requirements go, is often based on a certain multiple of the federal poverty guidelines. And because that's so common, we put a federal poverty guideline calculator here. Let me show you how easy it is to use. Let's say we have an individual that makes $47,500 a year. You can see I use that example often. You'll notice that I only typed in the digits. Don't type in periods, commas, or dollar signs. So let's say this individual makes $47,500 a year and they're supporting a family of 3. That's all the information you would need. You hit calculate, and the results yield that this individual's yearly income is 222% of the federal poverty level guidelines. When we return to the eligibility requirements section, you could see if that this individual clearly qualifies, which is great. But what happens if the calculation showed that he was not eligible? Maybe he found himself just above the eligibility requirements at, say, 305 or 310%. Well, when that happens, we recommend applying anyway and asking the program to make what's called an economic hardship exception. At that point, if you're still denied, you can always appeal. So one other quick thing I wanted to mention while we're talking about eligibility requirements is the residency requirement. Again, don't make an assumption here. For example, if you are working with a population that is undocumented, don't assume that they will automatically not be eligible. Be sure to check out the residency requirements, where we will provide the detailed information for each program. And again, if you have a question about any of the eligibility requirements, you can reach out to the program directly. Also, be mindful of the application section. This is where you will find details about if and how the doctor needs to be involved, for example, and importantly, how long it will take to find out whether you or the person you're assisting is going to be accepted to this program. That's important because you don't ever want to put somebody in the position of missing their medications. Following that, you'll find the medication section. And that section is important because it lets you know where the medications will be mailed and the details for reapplying. Always check out the additional information section because that's where we put all the other important information that doesn't fall neatly into the other categories. Usually I don't stop to take questions from the audience during the webinar, but I see one popping up that really give me an opportunity to highlight something important. And the question is, are prescription assistance programs usually more of a savings than the coupon? And can a patient keep using the same coupon each month? So if you are looking for assistance to help you afford a prescription assistance program, afford a brand name drug, you're going to want to check out the prescription assistance program first, because yes, pretty much always the prescription assistance programs will offer more of a savings than the coupon. Prescription assistance programs oftentimes offer free medication, and if it's not free, it's deeply discounted. And as far as a patient using the same coupon each month, it will depend on the type of coupon. But thanks for asking that question, giving me an opportunity to point that out. And before we move on from prescription assistance programs, I also want to point out under that patient savings tab, you'll see a section for help with prescription assistance applications. Now, these applications can sometimes feel complicated, so we've put together a directory that lists nonprofits that will help you apply, usually for free or a nominal fee. And as you can see, you can search for help in your area by zip code or state, and then programs will be listed alphabetically by city. Returning to that patient savings tab under that prescription assistance section, I'd like to point out our $4 generic discount drug program. This is a directory of all discount programs available for generic medications at major retailers. Now, although it's called the $4 generic discount drug program, most usually range in price from up to $4 to $15 for a 30, 60, or 90-day supply. Like the other sections on our website, there's a number of ways you can search. You can search, for example, for a specific medication. You can search for a participating store or pharmacy. But to keep things simple, I'm just going to do a regular state search. So let's see what's available in Arizona. As you can see, the results yield that there are 4 participating stores or pharmacies in Arizona that provide the $4 generic discount drug program. And on your screen, we hope you'll agree, is all the pertinent information you'll need. The left-hand column lets you know the name of the participating store or pharmacy and a hyperlink. The middle section lets you know the name of the program, and importantly, the far right column under program lets you know exactly the discount that this program will help you to realize. And again, although it's called the $4 generic discount drug program, most usually range in price from between $4 to $15 for 30, 60, or 90-day supply. So let's move on to another popular destination on NeedyMeds.org, returning to that patient savings tab, which is our free, low-cost, and sliding scales clinic database. Now, as you can see, this database, we're proud to let you know, to make searching easier, has been actually broken down into 4 categories. You can find a medical clinic, a dental clinic, a mental health clinic, or a substance addiction clinic. Now, these sections are all set up the same way. So for purposes of demonstration, I'm going to choose the medical clinics database, but again, they're all set up the same way. So let's go ahead and choose that hyperlink. And as you can see, we have just under 17,000 free, low-cost, or sliding scale clinics in this database. And like the other sections on our website, there's a number of ways you can search. You can search really specifically by the street address where you live. You can search broadly by your state. But I'm going to do a zip code search to see what's available. So let's say we want to find medical clinics within 5 miles of the 94974 zip code. You simply click search, and the results yield that there are currently 9 free, low-cost, or sliding scale clinics in the 94974 zip code. And again, hopefully you'll agree that all the important information is on your screen. We'll talk about the print column on the left-hand side in just a moment. The first column next to that is the clinic column. Will obviously let you know the name of the clinic, the contact information, and a website, which is really helpful if a website is available. The center section, eligibility, lets you know who can be seen at that clinic, and details such as what are the fees you can expect to incur, and what other languages does the staff speak. The column on the right-hand side, details, lets you know other specifics such as what services the clinic provides and the hours that they're open. Although we pride ourselves on the information on our website being accurate and up-to-date, if you have any specific questions such as whether the staff speaks another language, how much it will cost to be treated at this clinic, and to confirm the hours of operation, we recommend always reaching out to the clinic by giving them a call or visiting the website before you stop over. So I just mentioned before the print column, and this is really helpful. If you wanted to share this list of all 9 clinics with a loved one or a patient or client, you can do just that by clicking the Print All option, and it'll print a list of all 9 clinics. Or you can choose the ones by clicking on the box next to the name of the ones you're interested in, and instead choose the print option, and it'll do just that. It will generate and print a list including only the clinics that you chose. And again, that's a great tool for healthcare professionals that want to provide their clients, for example, with a list of clinics for them to choose from. Returning again to that patient savings tab, another important database is our coupon section. Now, I had a chance to mention this a minute ago when somebody asked if prescription assistance programs offer more savings than clinics, and the answer is yes, usually they do. But if you can't find a prescription assistance program, check out our coupons, rebates, and more database. And again, as you can see, that's under the patient savings tab on the bottom left side. This is where you can find prescriptions and over-the-counter medications or supplies for which there is a coupon, a rebate, a savings card, a free trial offer, or a free sample. Like the other sections on NeedyMeds.org, you can search a number of ways. You can search by the name of the drug. You can search by the name of the product. But in this case, you can also search by category, which means medical category. So let's go ahead and click on that. And here's a long list of medical categories. So let's say you're looking for a coupon for a drug related to asthma. Go ahead and click on asthma, and as you will see, there are those icons again, just like that prescription assistance program section. And that's helpful because it'll let you know if there are other cost savings programs available for an asthma-related medication, such as a prescription assistance program, or whether or not you can get it through the $4 generic drug discount program. And you can also learn more about the medication or product if there are support pages or drug videos available, for example. And let's take a quick look at what the coupon section looks like because it was updated at the beginning of the year. You'll find the name of the medication or product. And the way this used to be set up is there would just be a paragraph of information. Well, that was actually a little bit cumbersome and difficult to read, or so our users told us. So instead, we have a brief sentence or two followed by a bullet-pointed list of details, which is easier to read. You'll find a direct link to the manufacturer's offer. And you will also find an easy way to have the NeedyMeds drug discount card printed out, emailed, or texted to you. And of course, later on in today's presentation, we will talk about how the NeedyMeds drug discount card can help you. And underneath that, there are those icons again that let you know if there is more information available for this medication, such as the drugs.com link, which again will take you to drugs.com to provide more information about the medication. The drug videos icon, which will take you to a video about that medication. And the icon on the left here lets you know that there are some support pages available. And as you scroll down, you can see that it's all set up the same way to make reading this page a lot easier. So be sure to check this out. And hopefully at this point, you're seeing that the NeedyMeds sections on the website are all set up similarly. And that's purposeful because we want to make the website as easily negotiable as possible so you, your loved ones, your clients, or patients can find what's needed within a few clicks of your mouse. Now, aside from the prescription assistance program database, the second greatest source of savings is through our diagnosis-based assistance program section. Returning to the patient savings tab, you can see a section for diagnosis-based assistance in the top middle. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular diagnosis. Now, this database is a little bit different because for the most part, it doesn't include medicine. It mostly includes programs that will help you save on other necessary medical expenses. For example, maybe medical supplies, medical equipment, or things like testing supplies or wigs, house cleaning services, or assistive technology. Like the other sections, you can search a number of ways. You can search really specifically by the diagnosis, the state, and the service. You can search probably our least common section is by searching by program name. You can search by what's available in your state or nationwide. Nationwide meaning regardless of where you live in our country, you'll be eligible to apply. And you can also search by diagnosis. So I'm going to go ahead and click on that diagnosis hyperlink. And because this is a large section, like the prescription assistance program section, you will find an easy A to Z index. I'm going to go ahead and click on D for diabetes, and I really like to use that as an example because not only is diabetes commonly diagnosed in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Often diabetics need things like testing strips, syringes, or sharps, and assistive technology. Because diabetes is a broad category, you'll see it's broken down into a bunch of subcategories, but I'm going to go ahead and click on the general diabetes link. And the results yield that there are currently 72 diagnosis-based assistance programs for diabetes. And you may have noticed that throughout today's presentation, I keep repeating currently there are X amount of programs, or today there are X amount of programs. The NeedyMeds website is changing all the time. So the number of programs listed change all the time. So be sure to check our website regularly if you didn't have luck finding a cost savings program for the medication or healthcare expense you need help affording. Be sure to check back regularly. Okay, so there are currently 72 diagnosis-based assistance programs for diabetes. And the results are set up the same way as the other results from the other sections on our website, with all of the pertinent information now on your screen. On the far left-hand column, you'll find the name of the program and a hyperlink if one is available. Next to that, you'll find a summary about what the program offers. And the two far right columns are, I think, the most important information. It'll let you know the services that the program provides and the areas of service. So let's talk about that for a second. The services provided is exactly what it sounds like. It lets you know what this program will help you to obtain. Oftentimes, it's things like medical supplies or assistive technology. But as you can see, it does vary greatly. This program, for example, will help the person living with this diagnosis get some respite care. These programs will help the person to get access to a service animal. Now, the areas of service, you'll notice these say national on the far right-hand column. That's because we list all of the national programs first. And again, national means regardless of where you live, you're eligible to apply. And then under the national programs, as you scroll down, you will find programs available in each state listed alphabetically. So since we're on the topic of finding diagnosis-based assistance, I want to point out under that Patient Savings tab, diagnosis information pages. These are educational pages dedicated to specific diagnoses. Our goal with these pages is to partner with other reputable nonprofits to provide the most comprehensive information about a particular diagnosis. I don't want to spend too much time under these diagnosis information pages. I just wanted to make sure that you know that we had a destination on our website for these because they're really great for patients, especially that have been newly diagnosed. So returning to that Patient Savings tab, hopefully you're getting a sense of the types of assistance you can find on NeedyMeds.org and how to navigate your way through our website. We also have other categories that I'm not going to go into too much depth on. I'm just going to point out because they're set up similarly to the other categories that we've just reviewed. You'll find an entire section dedicated to medical transportation, because oftentimes getting to and from a doctor or specialized facility can prove burdensome. You will find categories dedicated to retreats, camps, recreational programs, and educational scholarships for people living with specific diagnoses. And be sure to check out the government programs section. This includes all state-sponsored programs, but it also has pretty exhaustive Medicare and Medicaid sites, as well as a listing of all of the federally funded health advisory programs known as SHIP or SHINE throughout our country that provide health insurance counseling to Medicare recipients. Now, I'd like to switch back to the PowerPoint presentation so I can review another important way to save on your medical expenses, which is with the NeedyMeds drug discount card. And before I do that, I just wanted to pop up a screen showing you all the healthcare cost savings resources that we just reviewed. And again, if you're interested in a copy of this PowerPoint slide deck, you can find it in the handout section of your GoToWebinar control panel. So let's talk about the NeedyMeds drug discount card. I'm sure you've heard of drug discount cards, which are exactly what they sound like. Drug discount cards is an actual card. It can be a plastic card, it can be a paper, or it can be an app on your phone that you bring with you to the pharmacy and match up with the prescription to help you to save on your medication or other expense. And I'm sure you've heard that there's other drug discount cards available out there. Well, ours is different because it is free and it's anonymous. We do not track your personal data, so confidentiality is guaranteed. There is no registration and no enrollment. There are no residency requirements and no activation necessary. And the NeedyMeds drug discount card is accepted at more than 65,000 pharmacies nationwide. Now, you can use your drug discount card to save up to 80% off the cash price of prescription medications. You can save on over-the-counter medications or supplies as long as they're written as prescriptions. And you can even save on human equivalent pet meds purchased at a regular pharmacy. And you can use the drug discount card to save 40% off medical equipment. So who can use the NeedyMeds drug discount card? The simple answer is anyone. The only rule is it can't be combined with insurance. So if you are uninsured or you don't have drug coverage, you can use the drug discount card anytime. If you do have insurance, you may choose to use the drug discount card instead. And you may want to do that if you find your medication is not covered under insurance. Maybe you find yourself in a coverage gap. Maybe you have a high copayment or high deductible. Or maybe you've exceeded a cap for drug coverage for the year. So let's return back to the live website so I can show you how to get your drug discount card and the tools for maximizing the savings. As you probably guessed, there's a number of places on our website that will bring you to the NeedyMeds drug discount card. Under the Patient Savings tab, you can see a link for it at the top left as well as the bottom right. But right on our homepage on the left-hand side, you will see a box that says Get Your NeedyMeds drug discount card with the red arrow. And all of those hyperlinks will take you to the NeedyMeds drug discount card page. And this is where you can obtain your own NeedyMeds drug discount card. You can print out a downloadable PDF. You can fill out this form, choosing a design. You can mail us a self-addressed stamped envelope to our P.O. box. Or, of course, you can reach out to our call center counselors. And that number on the top left-hand side is 1-800-503-6897. Now, at the bottom of the NeedyMeds drug discount card page, you'll also find our pharmacy search. And that's exactly what it sounds like. You can find out what pharmacies in your area accept the NeedyMeds drug discount card. And since there are more than 65,000 pharmacies nationwide that do accept it, I'm going to do a pretty narrow zip code search so you can see what the results yield. So let's say we're looking for a pharmacy within 5 miles of the 80906 zip code. There are 27 pharmacies within that zip code. And hopefully you'll agree that all the pertinent information is on your screen, including the name of the pharmacy, their contact information and address. We even have a helpful map if you're not sure where the pharmacy is located. You can also print out this list by clicking on the Print All. So now, ideally, at this point, you have your NeedyMeds drug discount card. You know what pharmacies in your area accept it. The final step is, how much will this medication cost you using the NeedyMeds drug discount card? And to find that out, you can click on the drug pricing calculator on the left-hand side. To find out what your medication will cost you, you will need to know the pharmacy zip code where you would like to pick up your prescription, the prescription name, the dosage, and the day supply, meaning is the prescription for example, 30, 60, or 90 days. So with the pharmacy tracker and the drug pricing calculator, you can find out where to pick up your medication and what you will be paying before you head out the door. And of course, again, I want to stress, if you don't have access to the internet or would rather get this information from a live person, don't hesitate to reach out to our call center counselors at 1-800-503-6897. I'd also like to point out on the bottom left-hand side, you'll see a link to something called Health Storylines. Health Storylines is a free self-care app that makes it easy for you to track and manage your health conditions and the health conditions of your loved ones. It also allows you access to the NeedyMeds drug discount card and other important resources on assistance programs. So check that out. You can download it for free through Google Play or the iTunes App Store. So I'm going to transfer back to the PowerPoint, and as I do see some questions coming in, which is great, and I will remind everybody, if you do have questions, you can go ahead and type them into that question section of your GoToWebinar control panel. And before I get to answering the incoming questions, I'm going to encourage you to please sign up for some of our other upcoming webinars. And again, you can find out other webinars that are scheduled and register for them by visiting the calendar of events on the bottom right hand of NeedyMeds.org, of the NeedyMeds.org homepage. And you'll notice on January 27th, we do have a webinar. It's a very brief webinar dedicated to explaining that Health Storylines free app. So check that out if you do have time. So as promised, I want to leave up the contact information for myself and NeedyMeds, and you'll also see an email from my colleague Alana. If you are interested in receiving drug discount cards or any of our educational materials, please reach out to Alana. So let's get to some of those questions coming in. The first question is NeedyMeds available to patients that have a Part D prescription drug plan? So that's a great question. And the answer is really, NeedyMeds is available to everyone. We are not a program. We are an informational resource that lists other programs. And you can find those programs on NeedyMeds.org under that Patient Savings tab, or giving our helpline call center counselors a call. The answer is, people with Medicare Part D, whether or not they're eligible will depend on the program. It will depend on the eligibility requirements on the prescription assistance program section, and it'll also depend, for example, on what the coupon allows. So don't make the assumption that just because somebody does have Part D that they won't be eligible. Just check out the programs we have available. And again, you can find that information under the Patient Savings tab, but I do encourage you to reach out to our call center counselors. And if you're not sure where to begin when you're reaching out to our call center counselors, simply give them the name of the medication you're having trouble affording, the name of the other healthcare expense you're having trouble affording, or the diagnosis that you're living with. That's a good place to start. So another question coming in is, if you have a pharmacy in your area that is not accepting the NeedyMeds drug discount card, well, you can always give them a drug discount card and have them call the number on the back of the card to participate. There's no reason that they really shouldn't want to participate. It would be a benefit for them, but they can certainly reach out to that number on the back of the card. Unfortunately, if they're not interested in participating, there's not much we can do. What I can say is that these 65,000 pharmacies nationwide that do participate, what that means is that if you find a pharmacy listed in our pharmacy search, that means that they are contractually obligated to accept the NeedyMeds drug discount card. On the outside chance that they are on our list of participating pharmacies and they give you a hard time, that doesn't come up often, but when it does, it's often because the new staff member hasn't been trained, for example. Again, there is a number on the card, or you can always email me the information, including the name of the pharmacy, who you spoke to, and what date and time you encountered that obstacle. Thanks for asking about that. So I have a question actually about, I mentioned that people can use the drug discount card to save on pet meds. And that is true. And if you'd like to learn more about that, we put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. Now, I can email that to you if you want to send me a message in that question section, or you can go to the NeedyMeds YouTube channel and type the word pets into the search bar. And the best thing about that is hopefully you'll be able to see a picture of my dog, Benjamin, who's pretty cute, if I don't say so myself. So another question coming in, and we're going to wrap it up with this final question, which is, and we get this a lot, which is, how does NeedyMeds support itself? So you can find what I'm about to tell you on the top right of needymeds.org. You'll see an About Us link. And this will let you know how we do support ourselves. And we have basically 6 sources of financial support. Like other nonprofits, we do rely on corporate and individual donations as well as grants. We do get fees from pharmaceutical companies for call center and application processing services. We have thoroughly reviewed supporting partners on our website. We do get a nominal transaction fee on every use of the free NeedyMeds drug discount card. We also sell something called PAP Tracker, which is we create a software that helps clinics, for example, simplify the application process of applying to prescription assistance programs. And we do license fees for organizations' use of our database. But again, we are a nonprofit, and we do rely on donations like other nonprofits. So with that, we're going to go ahead and wrap up today's presentation. I want to thank everybody for taking time out of their busy week to participate in the NeedyMeds Overview webinar, and we do hope you keep in touch. Thanks so much, and happy holidays.